I would like to take the next few minutes to tell you about anesthesia and sedation options at Parkcrest Dental Group. I will talk about local anesthesia, nitrous oxide analgesia, oral sedation, intravenous sedation, and general anesthesia. Along with each option, I will discuss their advantages and disadvantages. First, most people are aware of treating cavities with local anesthesia. Many people will incorrectly refer to this as a shot of Novocaine. Actually, Novocaine disappeared from dental offices decades ago. At Parkcrest Dental Group, we use local anesthetics that are reliable and predictable for anesthesia or numbness. We apply a jelly to numb the injection area and then give the anesthetic to block the nerve from the teeth or the area to be treated. With these anesthetics, numbness usually lasts for a few hours. The main advantage of local anesthesia alone is its low cost. However, some people have anxiety about their appointment and the dreaded shot. Nitrous oxide is usually given along with local anesthesia. With nitrous oxide, many dental anxieties are reduced. After sitting in the chair, the patient will breathe the nitrous oxide through a nose mask. Many patients will experience floating or a euphoria that helps them cope with anxiety. Some are not even aware of what is being done while still remaining conscious and responsive to questions. Advantages of nitrous oxide include its ease of administration as well as fast recovery. Disadvantages are few but can include nausea for a small percentage of patients. At Parkcrest Dental Group, some of our dentists provide oral sedation. Oral sedation involves taking a prescribed medication, waiting a period of time, and then completing treatment in the office. With the patient sedated, vital signs are closely monitored and the patient is treated with local anesthetics. Oral sedation is very easy for the patient to use and is a relatively low-cost option compared to IV and general anesthetics. However, inadequate sedation levels can occur that may not allow for treatment to be completed. Intravenous sedation, also known as an IV, involves the direct injection of a medication into the patient's bloodstream for sedation. This sedation, along with local anesthesia, is used at Parkcrest Dental Group by properly qualified and licensed dentists for more invasive or longer procedures. Through the IV, medications can be adjusted for patient comfort and medications can be given for nausea as needed. Our final discussion today involves being asleep for treatment. While the dentist is treating the patient, an anesthesiologist or certified registered nurse anesthetist working under the supervision of an anesthesiologist provides the anesthesia care and monitoring. These doctors and nurses are specifically trained in delivering general anesthesia. The treatment day with general anesthesia is scheduled after the patient has had a medical evaluation and clearance by their physician. With general anesthesia, great amounts of treatment can be done in one visit. In addition, very young or special needs patients can be treated in a safe environment. The greatest disadvantage of general anesthesia is the cost associated with it, as there are additional fees associated with the anesthesia services and for the treatment facility. In addition, more time off from work may be needed for the patient or caregiver, as recovery time from the medications may be longer. Thank you for listening to this Parkcrest Dental Group podcast. At Parkcrest Dental Group, our dentists offer options for your comfort. Whether it is local anesthesia, nitrous oxide, oral sedation, IV sedation, or general anesthesia, we can discuss your choices at your next visit.